Hi everyone. Thank you for coming today. I'm just going to get my slides up. 1 second. One second. Okay. Ready from the beginning. Okay. Can everyone see that? Shane, can you see it? Yeah. Great. Thank you. So welcome everyone who's here. Hopefully we'll have a few latecomers arriving as well. This is our fourth ARC Northwest Coast Seldom Heard Forum. And we're talking today about Gypsy, Roma and traveller communities' health and needs. So today presenting from ARC Northwest Coast, there's myself, Selena Willis, Shema Hassan, Nahid Tahir and Ruth Ball, which is that we are the members of the public involvement team. Nahid Tahir is one of our public advisors, who is a co-host and co-chair of this forum. That's what we look like. This is the agenda for today, and the agenda is also in the chat for anyone that needs to know who's presenting. So we're just going to do a short introduction and then we'll move straight into the presentations because we've got a busy day as usual. Anyone? Okay, so Nahid, would you like to take over to talk about housekeeping? Thank you.
I'm Nahid and I'm the public advisor on this forum as well as the co-chair. Welcome everybody. If you can, we would like everybody please to remain on mute other than if you are speaking. And if you feel we haven't seen your hand or anything, if you can get used to using the chat facility please, and just put an RTS in, which is request to speak, and then hopefully one of us will see that. As well as that, if you can keep an eye on the chat function yourselves as well, and that's for the presenters. So if there's any questions somebody wants to ask, you can ask through that, and then hopefully the presenters will be able to answer your questions through the chat facility. There have been a few cases where unfortunately online meetings have been hacked, and we're hoping and anticipating that this won't happen to us. However, if it does, we would like to apologise in advance and let you know that we will shut down immediately. Those of you who are on Twitter, if you can please tweet about today at our Twitter handle, ARC_Northwest_NWC. So that's at ARC_NWC. And everybody, hope you enjoy the afternoon. Thank you.
Thanks, Nahid. Brilliant. So just a really, for anyone who doesn't know, I think we've got quite a few people from ARC Northwest Coast and returning people to the forum, but anyone that isn't aware, ARC Northwest Coast stands for Applied Research Collaboration Northwest Coast, and it brings together higher education institutions. We're based out of the University of Liverpool, but we also work from Lancaster and UCLan. And then we have around 70 member organisations like the local authorities, acute trusts, CCGs, and also over 75 public advisors based geographically in the Northwest Coast. And we work together to support development, delivery and implementation of research into practice to enable real change for patients and the public to reduce health inequalities. And our vision is to improve health equity and applied health research through the voice of the population. So today it's our Seldom Heard Voices forum, and seldom heard groups refer to underrepresented individuals who potentially use health and social care services and are less likely to be heard by professionals and health services research. Often people in these groups face multiple barriers affecting their engagement and inclusion in health research, which is why we wanted to set up this group so that we can speak to different communities around our geographic area. So the forum creates an environment where ideas and views that reflect issues and needs experienced by seldom heard groups can be exchanged. And we should be joined today by a group of various kinds of people: researchers, PhD students, public advisors, practitioners, clinicians, to discuss how best to enhance inclusion in research and address issues faced by seldom heard communities, and hear from the communities themselves and members of those communities. So today's forum is looking at Gypsies, Roma and travellers, and I want to make sure that people are aware that that umbrella term is used, but not everyone feels comfortable within that umbrella, and it includes very distinct ethnic and different groups within that umbrella term. There are distinct histories, traditions, cultures and ethnicities under the umbrella term of Gypsy, Roma and travellers. But many of these communities face similar inequalities and experiences of racism, discrimination and poor health. So many organisations and governments use the term Gypsies, Roma and travellers in policy and legislature. I personally did live briefly for about 6 months on a new travellers site back in the 90s. This is a picture of where we lived, in a bus and a caravan. There are believed to be currently around 300,000 or more Gypsy and traveller people currently living in the UK. But members of Gypsy, Roma and traveller communities can expect to live between 10 and 25 years fewer than the wider population, and to spend less of those years in good health, because chronic exclusion across the wider social determinants of health put Gypsies, Romas and traveller communities at greater risk. And we're going to move on to the speaker sessions now. Thank you. I'm just going to stop sharing my screen. Great. So if we can have Alexandra Bahor from the Granby Toxic Development Trust, you are up.
Yeah, thank you very much. My role, I am a community development worker. From 2015, I work for the Roma communities here in Liverpool. First point is important to remember that when we discuss about the Roma, we talk about a group in the UK that has two distinct identities. First, they are migrants that comes from EU, and second, they are a protected characteristic as an ethnic group minority under the Equality Act of 2010. And also they are recognized by census first time like an ethnic group, and is a good way to be visible here in UK. When they come from EU, they come with a luggage of mistrust and fear. But also in the present, they are discriminated in their own countries. They come in UK with a mistrust in the services. We speak more today about the health, but also they mistrust the police, all the public services here in UK. When I started to work, I see this, and I don't know how to start to work. And I was thinking to work together with the community, but also with the professionals that works in the public services. This is why I make my projects with the Roma community, educational housing, them to trust the community, because they were thinking that the social workers, if they come to their home, they will come to take the children. If someone from school will knock on the door, they will take also the children. For them, this was the key issue. And was from my part, I needed to explain them, no, here in UK, you need to trust the services. Because when they come from Romania or Czech Republic, they were discriminated. It's not a problem they don't access, like they don't have the opportunity to access the health in their own countries. Here they have the opportunities, but they are afraid to access. And this was for my part, I needed to work. But this was not need, because was not enough from my part, only with the community to work. I understand that also the professionals, the partners that I work, they need understanding about the community, because they don't know about the culture, they don't know the history, they don't know anything about them. And this is why I started to make some cultural awareness presentation about the Roma, involve the children's centers around here, the GPs, and all the partners that I work in Liverpool. The main challenges that I speak is also in 2 points: the professionals, the services that work with the Roma, and the Roma. The main challenge from the Roma is the language barrier, digital exclusion, all the things that right now with the COVID, they are online. If you want to make a PCR test, you need to make alone at home and to register online. The Roma, they don't have access to the online. The Roma don't know how to access the online services. Also, with the there is they are afraid in Liverpool with the COVID-19. The Roma is a young community here in Liverpool. In other parts of UK, they are more old, but here is a young, like when I speak about young, 40 years old, 50 years old, the maximum of a Roma, that the age of a Roma woman or a man. This is why right now is a problem with the COVID-19, because the people who take the vaccine, they are young age, and right now they feel that they are afraid. They don't know how to make a PCR test. They don't know how to ask question. They are afraid of the vaccine and all the things. We find the solution, and I together with the GPs from Liverpool and also Gosia, and we organize an event in Collins Street where they are the Roma, traditional Roma, and we invite the GPs to make the vaccine and to give them the right information, because they need the correct information, because there is a vulnerable group, and they see all the videos or news from their own countries, and they hear only bad news. And when they hear about the bad news, they don't know how to react, or they don't know how to they believe, okay, we don't do the vaccine because we'll die directly, and this kind of things. They are afraid to do the vaccine. And I was thinking the good way is the professional to speak directly with them, to explain them and to translate for them, and for the Roma to have the access to the correct information. This is the main thing. Another we need, and I think that is important for us to have representation and to speak. And this is why we have we want from the community to have a voice. Us, if we know the best the needs, and people needs to ask us. We are here, and this is why, like, I wanted to thank you that you give us this opportunity to speak and to explain exactly what is the main issue in the community, and mainly with the Roma here in Liverpool. Thank you very much. And if you have questions, please put in the chat.
Thank you, Alexandra. That was so interesting to hear about the experiences of people, and how can you tell us a bit more about working with professionals around the COVID-19, and what did you set up any sort of clinics and things like that in the local areas?
It was last week, 1 week ago, we do a clinic directly in the community, because I explained to the professional, it's not enough to tell to the Roma, go there, you can make a vaccine. They need to come in the community. They need to bring the message in the community. and they understand. We have some people from the GP, from Picton Health Center. They come and they do some the vaccine in the community, and was like something that was a family fun day with a lot of children playing. We have activities, drum, music there. Because we wanted the family to have access, to know that what is happening, to not be afraid. The approach was different. This I try to explain to the professionals that the approach for the Roma needs to be different, because they have an expectation. This is the issue of the services who wants to engage with the Roma. They have the expectation that the Roma, they need to know all. If they come in UK, or if they are here, they need to know all the information, and this is not true. Like they don't know, and if they hear, they can hear like a false a fake news or a fake message, and this can harm them and their families. They need to communicate with us, the people who work in the communities. They need to speak with the people, and they need to ask questions. This is the main thing, communication.
Did you need to have translators there, or do you translate yourself?
I translated myself and two volunteers.
Well, that's really interesting too. And did you get a good uptake of once people were aware of it? Was it like word of mouth between?
Yes, this was because there was a problem also with the flyer, or like logistical things, and we don't have late the leaflet, but the word oral, all the communication that we do, and also in the pandemic we do by videos translated. We don't use the writing because a lot of Roma women families, they don't know to write or to read in their own language. In English is like very different, and it's very hard, and this is why we use more the oral. If they see us, they hear some music, they see that something happening there, they come and start to ask question. Professional things that is a hard like a community that you cannot reach, but if you have the key workers there, you can reach.
Yes, brilliant. I think there's been a question from Mark, who's asking about whether there are any information videos being made in Eastern European languages for the Roma community.
Yes, I think if you go in Liverpool City Council website, is our Liverpool team that we engage with them, and we do videos in Spain, in Czech, in Polish, in Romanes, in Romania, in Slovak, in all the language. You can find there, but also I think if you go by Roma support group, they have interesting videos and in Romanes. But it doesn't need to be in the East European, but in the ethnic group language.
Fantastic. Thank you. Are you planning any more days similar to that, Alexandra?
Yes, because I am part of the COVID-19 champions that I work together with Gosia here in Liverpool, and I am like 1 year. I am interesting, like to do this kind of events, and for the Roma to understand that here they can trust the services. That is not how it is in their country, and here they have the opportunity to access. I can give you a little, I write here also about the schools. A lot of teachers, they don't know how to approach the Roma. They think that they are travelers, that they will go back in their own country, and they don't want to speak, to explain them to the children that they can continue here the college, the university, they can do more with their lives, and they make them like separated, not segregated, but separate. They don't speak, they don't explain them, and they don't see that they have these opportunities. This is why we have like Liverpool John Morris University and a lot of college mini projects for this, to involve also in school issues the Roma.
That's fantastic. Thank you, Alexandra. I think there's another question in the chat, so if you want to answer any questions in the chat, and we'll come back to you in the Q&A session next. But thank you, that was really, really interesting.
Thank you very much. Thanks.
So next up, we're hearing from Irish Community Care, and I think we're hearing, I'm not sure who's going first. I think we've got Rahana, Andrew, and possibly Maria as well, who's coming up first from Irish Community Care.
So it's myself first, and I'd like to apologise. Unfortunately, Maria, who's one of our community members, is not able to join us because she just could not download the Zoom onto her mobile. And Andrew should be here, who is the advice and advocacy support worker for ICC, but I don't seem to see him on either. So you guys have just got me.
I'm here too.
Oh, there he is. Hi, Andrew.
Hi.
Okay, yeah, so it's just going to be myself and Andrew today. So I'll start off with, and just firstly, just to say, I've only been in post, this is the beginning of my 3rd week. So I've only been with the organisation for 2 weeks. So please do bear with me. And I just wanted to say again with Andrew as well, Andrew only started with me as well on the 6th of September. So if there are any questions that we're not able to answer, we will go away and get the information for people, make sure that people get the response. So to start off with, like I said, I'm Rahana Bashir and I'm the Business Development Lead for Irish Community Care. I'm going to be with the organisation for 6 months. I'm covering a maternity leave cover. So I'm here till the end of February. So my overall responsibility is to coordinate a range of community engagement and develop programmes across the Northwest, ensuring effective and efficient delivery and building sustainability in line with the business needs of ICC. So I just want to give a little bit of background of Irish Community Care. So it basically exists, the charity exists to ensure that we have well-informed, empowered and vibrant Irish communities in the Northwest. We are a leading participant in the provision of support, information and guidance for all Irish community across the Northwest. We directly work with Irish travellers and Gypsy traveller communities, and basically we are working with communities that demographically significant vulnerable communities are experiencing serious inequalities in health and socioeconomic disadvantages right across a range of indicators. As we all know, they face major barriers in accessing information and appropriate advice and advocacy, and also accessing services, and also sometimes are reluctant to access mainstream services. So within ICC, what we try to do is we try to identify and respond to the health and well-being, social care and cultural needs of the Irish and Irish travellers and Gypsy traveller communities. We provide a culturally sensitive advocacy information, advice and support service. And we provide support in areas such as accommodation, employability, including basic skills, welfare, benefit, looking after mental health and physical health, tackling loneliness and isolation. And we also have a reach in the prisons and the criminal justice system. On top of that, what we do is we have a community development programme which connects community members and building on strengths and developing new skills. So for example, at the moment, we've got our Cara volunteer programme and we've also got the new digital inclusion programme. We ensure that our services are all flexible, person-centred and holistic, and we deliver across an expanding geographical area which includes Merseyside, Cheshire, Lancashire and the wider Northwest. All our work is guided by our values, which is about care, community and connection. So we ensure that with all the communities that we work for, we champion the right for all of our communities to receive the best possible support and wellbeing services available. Our growth in the organisation has been a response to the express needs of our communities, and we make sure that any gaps that are existing within those communities, that we can provide a provision for them. And with our interventions, we ensure that we improve health and wellbeing outcomes. We tackle issues of health inequalities, deprivation and discrimination, and improve access to and retention within support services, and ensure all our services are culturally sensitive. So as I said, in ICC, we work strategically, locally, regionally and nationally. And our main aim is to ensure the voices of our communities are heard in consultations, developing and improving health and well-being and social care services. We have a range of leadership, people in leadership sharing knowledge, skill and good practice throughout the region. So just to give you a little bit of an idea where our funding comes from. So Irish Government Emigrant Support Programme is a significant funder for all the work that's done within ICC. We are also funded by Cheshire West and Cheshire Council for the work that we do in Cheshire. We're funded by the Liverpool City Council, and currently we're funded for the community champion work around the raising awareness around COVID-19 vaccination. And we also are funded by the Widow Bowl Council for doing that as well. We also get a range of funding from charitable funds, and currently we're also being funded by the National Lottery Community Fund for our Travel to Independence programme. So I'm just going to quickly talk about the Travelling to Independence programme. So basically, as I said, we're funded by the National Lottery to deliver a 3-year programme working with Gypsy and traveller communities in Cheshire. The programme has taken forward the recommendations of the We're Still Here report, and hopefully my colleague Andrew will touch a bit more about that when he speaks. So there's 3 elements within the Travelling to Independence programme. So the first element is advice, advocacy and support, which will improve the quality of life through equitable access to entitlements, services and opportunities. The other element is the asset-based community development. And what that is about is identifying and building on what's strong in our communities, building on the skills that are already there and mobilising individuals and communities to take action on things that are important to them. And the final element of that project is to strengthen partnerships and building bridges across Cheshire to address structural problems and social attitudes to improve outcomes for our communities. The staff team delivering that programme consists of a business development lead, which is myself, who is also the project coordinator. We also have a community development and engagement lead, which is Andy Kelly. And then we've got Andrew, who's also the advocacy worker. So within that, my role over the next 6 months with the Travel to Independence programme is to secure the necessary partnership arrangements, gain access to key people who will help our families access services, drive system changes, advocate on behalf of them, and look at allocating more resources to things that we need, work alongside other workers, and collect and record outcomes and evaluate our activities. So that's it from me. I'll pass on to Andrew.
Thank you. So I'm part of the Romany Gypsy community, and I've lived on Gypsy sites, unauthorised sites, private land and housing. I'm currently working as an advisor and advocate support worker for Irish Community Care, and I've been there for an entire 2 weeks now. That's going well. Before this, I had worked for other charity groups, local authorities and consultancy groups, all specifically targeting the GRT community. When it comes to health, we need to look at the overarching areas of GRT life that contribute negatively to the current results we're seeing. Important areas include housing, financial security, community safety, employment, education and environment. It's well documented about the current state of health for the GRT community, essentially that we have one of the lowest levels of health of all minority groups, including high infant mortality, suicide and life expectancy between the ages of 50 and 57. Although I believe there should be a focus on the specific issues of health, I do believe that by focusing on other areas, specifically accommodation and education, we will see better outcomes for the GRT overall. What I tend to find of real importance that tends to be forgotten in this general mindset of the GRT community is the general mindset of the GRT community, and that has continued on for at least 30 years now. It's a strong fatalistic mindset that things won't change no matter what is done in the short to mid-term. We can see this specifically when it comes to areas of health. It's normal to hear from the community that health issues will occur due to fate and that nothing will change that. I believe this may not be purely of a religious belief, but also one that is learned through experience. Such fatalism causes inaction and allows the status quo to continue. It will take time to remove this type of thinking, and although fatalism isn't a helpful mindset, it isn't without reason. I grew up on Gypsy sites across the east of England from birth to around 16 years old. During that time and over numerous sites, the issues of living conditions were the same. The level of poverty and subpar accommodation only helped to strengthen the feeling of being ignored while affecting the health of residents. Issues included old sewage systems and plumbing that would overflow regularly, waste on and in the vicinity of sites, mice and rat infestations, dangerous structural issues such as splitting brickwork, no heating, no insulation, broken fencing, lack of fire, water and electricity safety testing, The sites are generally built close to landfills, motorways and recycling waste plants, and the lack of hot water and maintenance upkeep. At around 25, I then became a site manager and liaised heavily with Gypsy sites within my locality. After a decade of living away from sites, I found zero change in circumstances for residents, and all the main issues expressed above were still being seen on a daily basis. Being on sites up until only a few months ago, I've seen resignation within the GRT community and apathy from local authorities to make changes. The problems are being ignored and they're leaving the GRT without basic living standards, which is negatively impacting their health. A 2012 report into Gypsy sites in Scotland showed only 10% of Gypsy and traveller sites were at or above basic living standards. No such report exists for England as of yet, but I believe from personal and professional experience for the numbers to be the same here. The lack of services, maintenance and inclusion always made us turn inward into our own culture. This created an us versus them mentality, and due to this feeling of being against society, when it came to going to school, my brother and I were the only ones on site to do so. Other GRT children would laugh and said that we were essentially losing our GRT culture. So even on site, there was a pressure to remove ourselves from education because it was seen that we were involving ourselves with a society that had a negative view of GRT groups. A little over 10% of GRT children finish secondary school, and only 3 to 4% go on to higher education. We're moving into a new school at 5 years old. My brother and I were targeted by the parents of the children who petitioned to to the school to keep us out. Thankfully, we remained, but we learned quickly to keep our heritage to ourselves. This was a beginning of growing embarrassment and fatalism towards the culture. Due to pressures from outside the community in ways of bullying and general discrimination, many other GRT children don't make it. This comes with the added pressure from inside the community, and parents do not always feel there is an obligation to keep children in school due to historical tradition. When local authorities aren't taking active steps to keep children in school, we see greater levels of poverty and unemployment of GRT people, which affects the overall health standards as they grow up. With lower education comes lower overall level of health outcomes. This is why I believe charities are needed more than ever at this time. Charities are always welcome to work with the GRT communities and experience positive results. However, within a few years, and through no fault of their own, funding is cut and these extra services are gone. Throughout my personal and professional history, I've seen the end of no less than 8 separate services that were helping GRT communities to gain education, health and financial security. This includes groups like Travellers Education, Sure Start and the NHS. Living on sites, I saw the aftermath that occurred to children who were gaining an education when services were cut. I saw the ill grow worse and die early due to having no health service or missing appointments due to illiteracy. And I watched families being evicted because their benefits were lost because they couldn't read the paperwork. These are all affecting the health outcomes of GRT. Longer term funding to allow a more consistent approach would be of greatest benefit. That is why I feel that much of the work to raise the health and well-being of GRT must come from charitable groups, and why our 3-year funding of Travelling to Independence will fill a gap to help GRT raise their health and well-being through various services. It's a hope that we and other charitable groups can dispel the fatalist mentality and help empower the GRT to move up in education, health and secure financial security. In time, I hope to see more young GRT making their way into professional business and becoming positive role models for the next generation. However, as I say this, I do know that more needs to be done in bringing greater understanding and equality within professional settings. In my position working for the local authority, it was important to keep a certain distance from my background. This is a normal mindset for GRT looking to make it into professional business settings. Although my line manager and close associates knew my ethnic background, those of other departments didn't. When working with police, planning, enforcement, finance and others, they would come to me for guidance on GRT issues, and each would quite happily give their views of the GRT community. There were points of a woman who hoped that there would be murders on the site, as it would mean that the sites would then be shut down. Others bought me gifts on birthdays that were derogatory. Even those who knew my background would often make derogatory remarks. To me, they were and have been such a regular occurrence throughout my life that it becomes normal. I'm also guilty of the fatalistic attitude. There was no sense of doing anything because it wouldn't bring any real change. And even if it did, I would then be known for my background, which from being a child, it was always important to hide. It can be obvious to see why a natural fatalism lives within the mentality of GRT communities. It's because over my lifetime, nothing has really changed, at least not in broad strokes where the GRT can notice that difference. As good as intentions may be, it's well known that the help and services for GRT tend to run short term and always come with the caveat that funding can be shut down. This has a negative effect on the ability to build a long-term consistent approach and relationship. Getting past a fatalistic viewpoint requires a greater level of consistency. At Irish Community Care, we are carrying out a 3-year travelling to independence effort, as my associates explained. This will bring real opportunity to open channels to the GRT across the Cheshire area. It's quite impressive that having had only 1 day so far on the sites, residents spoke positively about Irish Community Care, even though we had not seen them for between 4 and 5 years previous. This shows how much engagement can build bridges and how they can stay open over long periods of time, even when charity groups have been dormant due to lack of funding. Travelling to independence will bolster our connection to the GRT communities as we help in all areas that involve health. This includes areas around benefits to bring financial security, helping youth into education to raise understanding while simultaneously creating inclusion and integration, setting up GP and dentist applications to actively get the GRT into healthcare, and strengthening accommodations to secure tenancies so that all the above can take place. Over a 3-year period, I believe we can break down the fatalistic attitude and build on a more positive message of empowerment. Putting the power into the hands of the GRT and supporting them to move forward is an exciting prospect. I expect that by giving the GRT the tools and the ability to create their own direction, they will take it with both hands and create a better future for themselves. As we have 3 years to carry this out, it builds a consistency to show the community that we're here to work beside them and that we're not going anywhere for the foreseeable future. Now, to change gears, we had the CHOREC report carried out on behalf of Irish Community Care. The report, known as We're Still Here 2020, was a follow-up to the Here to Stay report 2006 compiled by Corinne Thompson. The interviews were all of GRT descent, living on either Gypsy sites or private housing, or obviously unauthorised encampments. The first issues comes in the form of permanence. Out of 125 people, 78 stated that they had a permanent address, 42 stated that they did not. 80 respondents also stated that they had not been at their current address for more than 5 years, and 49 stated that they had lived at a current address for less than 2 years. Of those in permanent residence, many complained of lack of basic essentials such as hot water, overcrowding, no gardens, and loneliness. The temporary nature of living, either voluntary or involuntary, shows the implications it can have on health. Without the basic fundamentals needed that come with a permanent address, the report shows lower levels of satisfaction. The report also shows the difficulties that GRT people have when it comes to claiming benefits. Issues of literacy, low to no internet service, overly complex forms, and bureaucracy leads to many GRT to lose out on financial security. The inability to claim entitlements leads to many of the GRT to feel helpless, stressed, and unable to cope. I have many personal experiences of the community being sanctioned due to illiteracy and finding the process or tribunal far too overwhelming to go through alone. This falls within issues of health when those with health issues, which were 27 respondents, feel lost and unsure of what claims can be made. With the use of internet and or mail, many respondents would not receive messages in time due to living a nomadic life and having no access to internet. The issues of education meshes with the previous points made when it comes to bureaucracy and complexity of finding places in schools for their children. Although there are no graphs showing in the report the difficulties of attending schools, there are views from GRT community. Issues of finding places, understanding local area restrictions, oversubscription and buying all bullying, all affect the natural outcomes of education for children, specifically as they move upward towards secondary school. Many parents speak of how they didn't go, but understand the importance of schooling for their children. However, this is not highlighted within the current reports, which actually show education for GRT is not only still worse, the worst of all minority groups is getting worse within the minority group. The report also shows that there's been better performance and satisfaction with doctors and private landlords, but there is a real lack of trust for the police and local authorities. The area of discrimination is still very high, with reports showing that name calling, spitting, moving seats because they're sitting next to them, being the most likely to occur. This was over 50% said this had occurred to them, while 10% reported physical violence. The positive changes a 42% increase in dental registration, which is great, 31% increase in gaining benefits, and there has been a 20% increase in uptake of education, although education attainment is falling. The negatives, unfortunately, are 30% increase in unfair treatment, 40% increase in abuse, 18% decrease in attaining a permanent address, increase in stop and searches, and a decrease in literacy. So there's still a very long way to go for the GRT. Thank you. I talked a lot, sorry.
No, thank you so much, Andrew. We could probably hear from you all day. I'm sure there must be so many questions for you. It's hard to hear your experiences and how difficult that must have been. And I'm just glad that we've had you here today to hopefully start that communication with the some of the wider organisations in the Northwest and the researchers, and hopefully we can start to make some real progress on some of that inequality that you've talked about. Does anyone want to ask a question of Andrew, or should we save it to the Q&A?
There are a few questions in the chat. I think quite a few people would like the link to the report that Andrew and Rahana were mentioning, I think. Great. If you're able to share that, that'd be fabulous. Thank you.
And did you say, Andrew, that I think that report was commissioned a few years ago? Are you going to be updating it, or was that the update?
Yeah, I mean, there's two. There's one of 2006 and one of 2020. So that is the newest one. Yeah.
Brilliant. Thank you. That's really helpful. Let's see whether there was. So Anna asked, what sort of healthcare do you think that Gypsy, Roma and Traveller community members access? Do they tend to use the GP or go to accident and emergency if they need sort of healthcare?
A lot of them will be walking. So yeah, there will be a lot of hospital admissions, but in the report it does show that GP GP attainment is going up. So we are seeing that starting to happen now, which is really, really something that needed to happen.
Yeah. That's good, thank you. Right, I think if anyone else has got any more questions for Andrew, if we can put them in the chat, and we'll save them for the Q&A at the end. And if we can hear from Gosia next, Gosia McCain, if you could.
So thank you very much for the invitation today. I would like to share a bit of my experience. It's kind of working with different organizations with the Roma community. Currently I work at Liverpool City Council as a community champion coordinator, but I think my kind of experience span over quite a few years. I was thinking to say at the very beginning, please don't judge me. I think all our work is a bit of a learning curve, and I hope that my experience will bring some benefits to you and to your learning and understanding. How do I do that? Okay, so first thing I was thinking that I guess the challenge, and Andrew mentioned that as well, from starting from his school years, is about the prejudice and discrimination that's in the people who are supposed to work with the Roma, Travellers and Gypsy community. And I was thinking that if we are serious about making impact and making change, maybe we need to first start with ourselves and ask ourselves, what kind of image of other communities, minorities, groups we have? Because if we have stereotypes in our head, that's how we will act. If we believe that those communities, I don't know, whatever we believe in, we act through our beliefs. And I was thinking about myself. I'm Polish. I was born in Polish. I live here. I was born in Poland. I live here now for 21 years. And living in Poland as a child, you've heard the messages that you should never trust a gypsy, the Gypsy steel, and the image that's here, that was presented, that they come and try to tell you the future, but actually they will rob your money. The challenge of the beliefs is that we so strongly linked with them that we always in our life look for proofs of it, and that's why it's really hard to change them. But unless we see the potential of the communities and we see that there's opportunity for change and give those opportunities, I feel like the situation will never change and will kind of continue in the same way. We have to be more open-minded in many different ways. I will talk more about this in the presentation. So my first experience here was when I was working for Yellow House. It was a charity working with local young people in Kensington, in Liverpool. It was a time of Kensington regeneration. There was a special funding provided for the area, and the council was trying to engage with lots of different communities. It was 2007, so it was after those additional European countries joined EU. And in Kensington and Picton area, there was a high number of the Czech and Slovak Roma community. Council reported there was lots of issues with gambling, with drinking alcohol on the streets, with gathering, dropping rubbish, and they wanted to address it in some ways. I don't think that there was any idea how to do it, and that's why they approached Yellow House and me to try to develop some kind of project. I speak Polish, I don't speak Czech and Slovak, but those languages are quite similar. So if I speak Polish, Czech and Slovak people can understand. I wouldn't translate, I would interpret at the doctors, but kind of general conversation is okay. So we organized a meeting at the Kensington Fields for the Czech and Slovak community. And the first thing that was really clear is how separate the communities were. So there was the Czech people, Slovak people, Czech Roma, Slovak Roma, and there were really 4 distinguished groups. So again, that was an interesting kind of learning for us. And talking with the community, what we decided to do at the end is activities for families, because lots of people said they had little children, and that's something that they were really interested in. So we agreed that once a week on Sunday afternoon we will have a session in a community hall in school in Picton for the children, kind of arts and crafts, music activities. And I remember the first week we came ready to deliver the project, and there was just nobody there. The committee didn't come, and it was such a disappointment. But actually what we've done, we contacted one of the community leaders. It was Vincent, and he rang a few people, and in half an hour there were hundreds of people there. And I think that was kind of interesting experience, that how the community kind of works and organizes itself, because it often has informal leaders and the community responds to them. So working with the community, I think you have to respect that. Another experience was that the families that came, each of the family had quite a few children, and you could see the devotion of the parents. So again, we kind of realized that we can build on that potential, and from week to week we developed those activities. But then when project was coming to the end, we had a meeting with the local authority. I think for us, what we felt was kind of good long-term development was to designate a space for the community. Because if you could provide a space where the community could meet, there wouldn't be the issue of kind of gathering on the streets or, any other things, leaving the children out on a street till late at night. We negotiated that for a while, but actually that kind of never progressed. And I really think for me, it's such a disappointment, because that was 2007. If we would have done something then, we may have had from those young people who we work with, who were kids, we may have had now young community leaders. And I really think that thinking of working with communities, we have to think long term and trying to work step by step, initially engage with something that is important for the community. And with Roma community, the families, the children, that they are kind of the center. And I really think we need to respect that. One thing that was, I would say, a great achievement in some ways, that because during those activities, we had some music and singing and dancing. So from that group as well, a band formed, and this is a little press cutting from a Kensington magazine. Again, I think that was fantastic. I think it was mentioned in one of the previous presentations that we need to think of what's particular skills of the community and build on that. For the Czech and Slovak Roma community, the music was something of great importance, and there were lots of really talented people. So we started with the band, but again, lack of support meant they really didn't survive for longer, which again, I just think that the short-term projects don't work. We just need to make sure if we start anything, there's a long-term commitment to support people. Because I think Alexandra mentioned, people come here from a different country, they don't understand how the system works. And as well, what kind of support opportunities they are for the community. And my next experience was when I worked at the city council. It was just for a year as a community officer, and I felt again, it wasn't really well planned. So I kind of felt like it was kind of putting fires down. It was kind of going all the time for another emergency because there was some kind of conflict between the neighbors. There was some issues of rubbish on the streets. And I think that's just a totally wrong way to approach it. We try to work with the local police, with the health service, with schools, because there was definitely lack of understanding of how the community functions was important for them and how to approach them. Again, some things that Alexandra mentioned about the level of literacy and how we can pass information to the community. I remember working with schools who are saying that there's a really lack of attendance by the young people, that often they are called by the parents to help with the younger siblings. So again, for me, it kind of indicated that there's more work in kind of raising cultural awareness, understanding how the families works and working with the families to dedicate that kind of time to education, which it often in the original, the country of origin wasn't important because they were moving often from place to place. I think the issue of working with the local authority regarding the Roma community was that often the experience in the home countries was so negative. I remember again speaking with some community representatives who were saying that in, I think at that time, Czechoslovakia, the Roma community was forced from the sites to live in the flats. They moved the kind of way of life to the flats, to the cities, which didn't work, of course. If you start a fire in the middle of a flat, there will be another challenge situation with the neighbors, council and everybody. And I just think we need to acknowledge as well that those communities coming here have issues with the communication, with language, with literacy, but often such a big bag of negative experience from the home countries, wherever they came from. And at that time as well, I met with the Polish Roma community, which again, I wasn't aware before that there was a Polish Roma community in Liverpool. And interestingly, they came much earlier, before 2004, as asylum seekers because of the prejudice and discrimination in Poland. So again, we are trying to kind of make some work now, but it is much longer term, because I think we think that within a year we can change the community, but it's very much kind of based on life experience kind of shared over generation. And we know how sometimes for us personally, it's difficult to change our little habits regarding our health things. We know what we should do, but we don't. I think for the community that survived on particular way of living, it's even harder. So I think we need to work much closer to support it. And currently, I'm working as a community champion coordinator, and I'm really happy that as part of this group of 12 organizations, we have Irish Community Care and we have a Granby Toxteth Development Trust, because I really think that it's the communities that can make a difference, not really the services. We need the communities to be that kind of a bridge, the community organizations to be that kind of a bridge between the community and the local services, because there's so much misunderstanding and there has to be so much learning both ways regarding the community, but as well regarding the services. We often call them hard to reach communities. They are not hard to reach. It's just sometimes the way the services try to reach them is not appropriate or not the best way. So I really think that I hope that this program will really support those organizations to build kind of better engagement and more trust, because I would say that working with communities, it's all based on trust. There is, a year for us to try to set up some things and start that process, hopefully, of change. And I'm very much committed. I think for me, from those previous presentations, I think there's kind of quite a few things to think about and take on regarding how we work with the communities. But I just think there has to be much closer work together, and I kind of hope that will be part of this program. So if anybody's interested, I put my email address as well and I'll be happy to link with anybody regarding this work, because I think it is an important process, and I just think I wouldn't like any community to be left behind, because everybody and every community brings so much if we only give them that opportunity. Thank you.
Thank you so much, Gosia. So much to think. Half the problem with these forums is we just don't have enough time. We could really hear from everybody, and so important hearing about I think you're right about thinking about communities. We don't want to leave anyone behind. We don't want to miss out on the wonderful. It's not. I think sometimes we hear so much about what is wrong with communities, but like you say about that, the asset-based approach, like Andrew talked about as well, about thinking about what's strong in the community and what can they give, so that we can value those people and not just think, oh, what also needs to be improved. But obviously we need to work on both. I think I'm not sure if there's any questions in the chat right now, but we'll save them for the Q&A, and we will move on to ask Charmaine to speak. Charmaine, are you here?
I'm here.
Brilliant.
Hello, everyone.
Thank you.
Please excuse me, because I'm very, very new to everything like this. So my organisation, the organisation along with some of the Romany Gypsy people is called the Pride of Romany Gypsies. We're a grassroots organisation, and our aim is to preserve and protect the rich Romany and Romany Chal heritage, including its traditions, customs, culture, craftsmanship and language, to create educational and support programmes in liaison with public sector bodies to protect and support the Romany community, its tribes, and focusing specifically on mental health, suicide prevention, domestic abuse, pregnancy, postnatal, homelessness, addiction recovery, and immigration support. To create campaigns targeting hate crime and ethnic targeting of the Romany and its tribes, specifically on social media platforms and in the written press. We want to hold community gatherings and events for the Romany and her tribes to share our work with them, public sector bodies and academics, to encourage the creative arts within the Romany and her tribes and give opportunities for those who excel in those areas. Our objectives are to assert the specific struggles and ailments facing the Romany and its tribes, medical, historical, legal, etc. with the alignment of the wider community in pursuing change. This is inclusive of advocating for the education of wider society to what Romani tribes are and the appropriate language and terminology in policy making and wider sector services, which reflect the specific identities of said tribes and wider groups. To educate the public sector and the community, moreover, the people of the Romani and its tribes that have not grown up within the tribe environment, accompanied with a lack of understanding or knowledge. This will be achieved through community spaces, events and workshops. This includes working to have a better understanding of what the Romani and the tribes within that group, their journeys, history, genetics and its importance, while further understanding the spectrum of privileged and lived experience. To share with the public sector and the community a richly researched and sensitive historical journey that spans since 1490 in the United Kingdom. This will be achieved through resources, event spaces, talks and community spaces to form oral and written archives. To develop services, caseworkers, signposting and advice to Romani people regarding direct needs such as emergency housing, domestic abuse support, visa advice, site discrepancies, advocacy, pregnancy and postnatal support, and peer mentoring surrounding addiction recovery support. To support young and older Romani creators from all of our tribes and fund exhibitions of their art and especially traditional crafts which have helped further to keep traditions alive within the community. Our goals are to establish change in the Northwest for Romani people in terms of accessing to local support, advocating for community needs to public sector services and council bodies and developing community spaces. We want to create seminars, workshops and events for educational purposes with public sector bodies in Cheshire and the Northwest of England. We want to encourage traditional craft dancing and maintenance of language and culture. We want to hold annual gatherings where awards will be given to public sector bodies and academics who have worked hard to help this project to advance and celebrate the kindness shown towards our tribes, to have a dedicated website to the rich stories and historical content of the Romani Child tribe and further Romani tribes, to develop solidarity between Romani Gypsies and wider Romani groups to ensure to offer direct support to Romani groups within the UK. All I can say really is my experience is a lived experience. I've lived through inequality. My late sister died because of medical inequalities. Also, I think there's a lot surrounding terminology. So the terminology, I mean, not a lot of people have heard, shockingly, of the Romani Child tribe of Gypsies. We have been in Britain since 1490 and we are losing our heritage and our culture because of terminology. We're often deemed as travellers when we are actually Romani Gypsies. Through, we have, lots of medical disorders, genetic disorders that are not specific to Irish travelling communities. And I think we are failing the Romani Gypsy community and the British Romani Gypsy community because we are not seen or heard of. I've listened absolutely to what everybody has been saying and I agree completely with it. But I also want to bring to the forefront of all of this is that health inequalities, racism, and all the things that everybody's spoken about, my body of people actually deal with those inequalities too. My own experience when I was having my son was that midwives said to me in my birth experience that my kind of people, when she learned that I was a Romani Gypsy, want to come into hospital, push our children out and steal everything on our way out. I was also told that I wasn't going to have my baby washed because that's not what my kind of people do. My children have been racially discriminated against and I want to stop those failings and make things better. Also, I've heard a lot of people saying that, we like to shift blame on communities and say that the wider community don't help us. But since I have set this whole thing up, the wider community have wanted to help, public sectors have wanted to help, the police want to help, the medical profession want to help. And it's about meeting people halfway. and creating community unity. So everything through education. There's always room to learn from each other, to better relationships between our communities. I mean, the British Romany Gypsy community is an absolutely beautiful one. Our heritage and our traditions and our values are, you know, to be envied. A lot of Gypsy people, sadly, and again, that's why I want to create something where our young people aren't afraid anymore to say, I am a Romany Gypsy, because of the stigma that's attached to our community. So historically, the historical fear of, you know, the police, of the public sector, of social services, taking our children away, up until very, very recent years, our community, you know, were hung not so long ago. You know, our people are silenced, and you know, we have a lot of people talking on our behalf and often getting it wrong. And that's why I want to change things and create a safe space for not just my tribe of people, but also our Eastern European cousins, to have a space where we can speak and we can talk for our communities. I spoke with a liaison officer and I said, you know, I wanted to know the volumes of Romany Gypsies, you know, in our area, so I could kind of gauge, you know, how many people wanted help. And our liaison officer actually said to me, we don't count Gypsies in houses. And I was blown away from that, because again, you know, the British Romany Gypsies are not actually counted, you know, from a Gypsy liaison group. So I just want to change those things. You know, I want to educate, to re-educate people, and for people not to be afraid to ask us things, and also to speak on my community and help people in my community, and let our voice be heard, because our voice has been silenced and overlooked for hundreds of years. And I just want that to change, not just for my children, but for our future generations. Thank you for listening.
Thank you, Charmaine. That was very powerful. It's even hard to try and say how I feel so awful about your experiences when you were having your children, and how difficult that must be for you to have experienced that kind of, in that kind of a situation when you're so vulnerable, and it should be a time where you're rejoicing, and to have people treat you like that, I'm so sorry. But I hope that we can support you with your new venture, which sounds really, really exciting. And I'm hoping that today, having everyone in all these different groups together, can maybe continue working together to support each other to improve the experiences of all the different communities that we've talked about today. Thank you. Has anyone got any questions for Charmaine?
Other questions in the chat for Charmaine, Selena. If, I don't know whether Charmaine, you can see the chat, whether you can respond to them.
Yes, people are wanting to stay in contact with you or make contact with you about your organisation, and to stay in touch. So we'll hopefully be sharing a platform soon where we can continue these kind of talks and discussions and share good practice and experiences afterwards. But in the meantime, if you are happy to be contacted, please do share your details in the chat. That'll be really good. Thank you. We'll save any more, I think, for the chat, the Q&A afterwards, and we'll just move on to our last presenter, and we should have time afterwards to take any other questions. So please do think of your questions while we're hearing the last presentation. And this is going to be Susie Hargreaves from the University of Salford. Welcome, Susie.
I'm just going to try and share my screen. Every time I do this, I completely mess it up. So I'm going to try my hardest. See, I've already gone wrong. 2 seconds. Oh, sorry. Can you see that? No. Can you see that now?
Yes, we can see it now.
Okay. Okay, brilliant. I can't see your faces, so I'm sorry about that. But I'm just going to, my presentation is probably quite different because I'm looking at it from a research point of view. And I work at the University of Salford, but I'm also working at Swansea University, and I'm completing my PhD at Liverpool John Moores University. So I've got lots of different hats, and I'm gonna go over a couple of things. So first of all, I'll just quickly introduce myself. I won't dwell on this too much, but my background as a researcher is in public health, and I've been doing that since 2001, so it's been quite a while. And over the years, I've worked on sexual health, substance use, which has included drugs and alcohol, communicable diseases such as HIV and STIs, mental health, and most recently community health. I started my PhD at Liverpool John Moores University in 2014, and I'm due to submit in the new year. So everyone keep your fingers crossed that I can actually get around to doing that. And I'm currently working both at the University of Salford on a breast screening programme piece of work, and I'm working at Swansea University on a piece of work which I'm going to talk about later on alcohol and Gypsy, Roma and traveller communities. So what I'm going to go through today is my PhD study, which is exploring mental health and substance use needs amongst Irish travellers, using evidence to inform service development. And I'm not going to look at all of that, and I'm not going to look particularly at the results of that. I'm going to talk about how, as part of the project, I built relationships, and I did observations and reflections and things that helped build those relationships to ensure that I was able to do interviews about mental health and substance use with Irish travellers. And I'm going to have a really brief little look at the Swansea University study, telling our own stories, and that's an exploratory study of alcohol use and harm by people who identify as Roma, Gypsies and travellers. That's a community-based participatory research project, which I'll go through in a moment, working with peer researchers from individual communities, and the advantages of that, of using that approach for participants and for the whole research process. So my PhD aims are to address current gaps in the evidence base of how to provide and promote accessible and appropriate services. This is such a mouthful, and it's one, and I have to say it quite a lot, so sorry, but it's to look at preventative community-based services with a specific focus on mental health and substance use. And it's hoped that the research findings will inform service development and delivery, and it will support and promote accessibility of services within a community setting. So the PhD programme consisted of 3 studies. The first study was about observations and a pre-development phase, which was formal observations at drop-in services, attending meetings and visiting traveller sites. And the other 2 studies were views of key stakeholders, so that was service providers of health and wellbeing services within the area, so this was Cheshire and Merseyside. And then I did a number of semi-structured interviews with Irish travellers, but I'm just going to concentrate on this pre-development phase and go into that in a bit more detail. I worked very closely with Irish Community Care, and it was the idea of the PhD initially came from them. They worked closely with John Moores University, and I applied for the PhD, having done a little bit of research with English Gypsies in the past as part of some sexual health research. So I've worked very closely throughout the whole PhD with Irish Community Care. And that has pretty much been the basis of me being able to build those relationships successfully. So the written there, there's a reference there to Marie Claire Van Out, and she did some research on alcohol use in the traveller community in the west of Ireland. And as part of her research, she conducted a pre-development stage, and this was ahead of the study on the alcohol use, and it involved a number of focus groups to build up trust and a commitment to the research for both the researchers and for the people taking part in the research. So as part of my PhD programme, I also used this relationship building period to get to know both the traveller families that I was going to work with and also Irish community care, and get to know people who work there and the outreach workers. So I did this through mainly through shadowing outreach workers, and I went with them to their drop-in services in Cheshire and in Liverpool, and I shadowed them basically. So I went to residential sites where it was appropriate, and I sat in on the drop-in services and had discussions with, it was very open about why I was there when people were dropping in for help with various things that they needed, and it was quite a relaxed, informal process. So I sat in with them, and on occasions, if there were children there during school holidays, you know, I ended up looking after the children and doing drawings with them. So it was very informal. But it was quite important preparation work. So I immersed myself as far as possible as I could into the community through working with Irish community care and using participant observations and keeping reflective diaries as soon as I'd come out of those meetings. So I wasn't writing in the meeting, I wasn't making notes in the meeting, but afterwards, and I reflected as much as possible. And the good thing about that meant that it was getting my face recognised. It was being transparent about why I was there, being open and sensitive. And it was also time for me to get to know them, so that when it came to doing interviews, and neither myself or my participants in the research were going into the interview cold. So they had an idea who I was and what I was doing, and I'd already met them, so I wasn't nervous either. Because I know lots of people talk about it's quite nerve-wracking going in and having a researcher interview you, but not a lot of people acknowledge that actually it can work the other way as well. So having that preparation was really useful. Initially, that was just going to be a pre-development, so it was going to be before the research took part. But as it actually happened, this stage continued throughout the whole process. And I continued to shadow the outreach workers and attend the drop-in services, because it was a really useful way of being involved and building that trust, really. And that didn't just stop as soon as I started doing the interviews, it continued throughout. So things that helped with that were being open and honest and transparent. When I went into an interview, if it was the first time I'd done a particular interview, or if things were maybe a little bit awkward at the start, being open and honest and transparent really helped. I think it helped that. So if I said, oh, I'm a bit nervous about this, or, oh, this is the first time I've done this, or, if I was very honest, I felt like I got some of that back in a way. It felt like it was more transparent. They didn't think I was up to anything, and they knew exactly why I was there. Having a flexible approach is really important, and it took me a little while to get used to it. I'd done a lot of quantitative research with data and beforehand, so having this flexible approach when you're working with people whose priorities aren't necessarily research, and they have perhaps lots of things going on in their lives at the time, things like organising interviews just didn't always work. So having a time and a place to meet didn't always work. So I had to do a much more flexible approach. So if I went to an outreach centre and there was someone there and they had the time to do the interview, I would go through it and do it there and then. So that was quite an important part of engaging with people. And the other thing I found was to join interviews when you're sort of getting to know people. I found that people who I was interviewing wanted to get some sort of relationship, even if it was just something in common, and it made things a lot easier. So the example that I'm thinking of was a man who had some alcohol problems, and we were doing an interview and we didn't have a lot in common, and it was awkward at the start, it was difficult. And then as soon as he started talking about his children and his grandchildren, I mentioned I had a child of my own. So I didn't give I didn't give my life story. I just said, oh yeah, I have a child that age as well. And it actually made a genuine difference. There was some sort of connection. It was tiny, but it was there. So I think that giving something of yourself made a really big difference in the interview. The other thing was, don't assume anything. So don't assume that somebody can't read or write. Be transparent about what you're doing, what you're writing down. Don't assume that someone knows what you're talking about. Try and be open and as clear as possible. To be aware of a few things, so your own misconceptions. So you might, researchers don't grow up in a bubble. They live within their own communities. They may have heard things about, for instance, travellers that aren't true. So you've got to be very aware, and you've got to really examine your own misconceptions or conceptions of, or perceptions of communities that you're working with, and you need to really challenge those. The other things like body language, so trying to be informal and open, and the comfort of your participants. I had one participant who unfortunately during the interview was really hungry, and she kept saying how hungry she was, and I kept saying, we can stop if you want. And actually in the end we did stop, and because you just can't do an interview with someone where they're not physically comfortable. It's no good for sort of anyone. And the thing that I have to be aware of a lot in research with communities that I'm not a part of is awareness, and be aware and acknowledge your own outsider status. So I'm not a member of the community that I studied. I'm not an Irish traveller, I'm not Irish. And I'm from a majority ethnic population. So by definition, I'm in a position of power when I'm doing research. And I'm conducting research with people who have different life experiences to my own. So I had to be reflective during the whole PhD process, from the design and the data collection, the analysis and the write-up. And there are some advantages in being in an outsider position. My participants were able to ask or answer questions that may have been sensitive. They may not have wanted to be asked by a member of their own community. And one of the main things that helped, that I've already mentioned, was my relationship with Irish Community Care, who have very strong links with the traveller communities, the Irish traveller communities, and that enabled a level of trust that I might not otherwise have gained. They acted as a bridging organisation, and helped enable the research. And I definitely wouldn't have been able to do that without them. So they've played a big part. So I just put up a slide here that was from Leadsgate, which is an organisation who are very much a traveller-led organisation based in Leeds, and they have a really good flyer on top tips with working with Gypsy and travel communities from their own experiences. And they're based on communication, literacy, trust, reasons why you're there, and other tips that are really useful. So having an understanding of those really helped when I was building relationships as well. Sorry if my voice is going a little bit. I've been talking all day. I'll just really briefly go through the project that I've just started with the university, with Swansea University. When I was doing my PhD work, I was very aware of those things that I mentioned about the fact that it's not necessarily equal if you've got a researcher and a member of the community, and that is definitely a limitation of the PhD studies. So when I was able to help write the bid for this project, this Swansea University project, I was really interested by the fact that we were doing, that it was a community-based participatory research project. This is something that sort of helps with the fact that it's, you know, that it's not just a researcher going in and doing research on the community. So in the past, as we know, research involving communities hasn't always included anyone from the communities, and there's a sense that research was done to different communities, and this can lead to distrust of research or a misunderstanding, and members of the communities who are being, you know, who are involved in the research feel exploited and that nothing's done with their contributions. So this community-based participatory research approach aims to change this and to include community members from the outset in the design and to form equitable partnerships with academics with mutual respect and reciprocal knowledge sharing. This project is at an early stage at the moment, but the interview guide is being developed with peer researchers. The peer researchers have helped with other projects in the South Wales area, so they're known to the research team already, and contacts are being made with community organisations to build links to train further peer researchers, and this is happening at the moment. So the peer researchers are planning to go into a certain communities, Roma communities, Gypsy communities, traveller communities, and also boaters. And boaters are slightly separate in that they're not, it's not an ethnic group. So that is a little bit different, but the Roma, Gypsy and traveller background, the peer researchers are going to go and do those interviews with them, and they're going to talk to them about how they drink alcohol, and they're going to work with community members to try and create some resources that will help inform health promotion, so that they're not, people aren't just not going away from the research thinking, well, why did I do that? Hopefully something will come from that. So we're doing that through in-depth interviews and then use of scenarios. All of these are also called qualitative vignettes, and they're to encourage conversations. So depending on who is being interviewed, there's they'll be given a short little scenario of something that involves drinking alcohol, and then there'll be some follow-up questions about how would you know, whether that would be the same in their own community, how would they approach it, what do they think of it, and it just gives us an idea about topics that may be very difficult to talk about, but if you're talking about them in the context of a scenario, it prompts that conversation. That's the idea. So as I say, we're right at the beginning of that, and I'm hoping that's going to be really successful. So I just thought I'd tell you about that as a sort of a next step from doing interviews to actually involving people more from the community to help do those interviews. So that's that. And there are just a couple of useful guides and references. I know that people have done lots of how-to guides for engaging with Gypsy, Roma and traveller communities, or with the supposedly hard to reach communities, and they're just a couple that were quite useful. So I'm going to end that there. I hope that was all right.
Fantastic, thank you, Susie. That was fascinating. Really, really interesting to hear about your thoughts around different methodological approaches and how using co-production, which is obviously something that ARCs, you know, have as their sort of main focus, to work with community members of the public, and also sort of clinicians and practitioners together, can actually make a much more progress than doing research sort of on groups. Are there any sort of you did a slide on things you should do. Is there anything you'd say you've learned maybe you shouldn't do, or as a researcher working with the community?
Yeah, I mean, there's some practical things. I had one interview that wasn't going very well, and it was not entirely, well, it was nobody's fault really. We happened to be in a room that had a table in it, and it was a small room, and it just, the person I was doing the interview with, well, they thought I was a police officer. And so because I was asking him a few questions to sort of get the conversation going a little bit, just some general questions, and he looked at me and he said, "Are you a police officer?" And I was like, oh my God, because I realised I was sat behind a table with a pen in my hand. I was wearing a black top, and I didn't, and I was asking him questions. So I went through, because I had gone through all the consent and all the information forms. So I went through all that again. I made sure that he understood that I wasn't, and I sort of made sure that I was sat back and that it was a little bit more relaxed, and that was quite early on, and it didn't happen sort of with anyone else, but you know, you can go through and do loads of interviews and loads of engagement type research, and everything's fine, and then you'll just have one person where it just doesn't click. So you've got to be aware of that each time.
I think it's interesting to think about how, you know, quite often we're taught as a researcher to be sort of, you know, very not friendly, but not sort of have those kind of conversations, and not make it sort of, you know, you don't talk very much, you're asking very sort of questions, but it's asking a lot of that other person, isn't it? If there isn't a trust and there isn't that relationship, to sort of expect people to just open up and answer things. So yeah, that's really interesting. We're going to go into the question and answer time. So if anyone's got any burning questions, just before we do that, I'll just mention, as I just said to Susie, ARC Northwest Coast co-produces all our research with members of the public and communities. So if anyone who's here today is interested in becoming a public advisor for ARC Northwest Coast, we'd love to have you. So we can put the link in the chat and just get in touch with us, and we can have a chat about having you as a public advisor, and because you know, we'd love to have other community people involved in the research. Does anyone have any burning questions for Susie or any of our other presenters, or are there any in the chat? Have you seen Ruth or Shema? Also, you can put your hand up if there's one of those reaction buttons where you can put your hand up if anyone wants to ask anything of Susie or any of our other presenters. Just going to go through and see if there are any.
I think Charmaine had asked if our last speaker had done any interviews with the Roma community. I'm trying to find the question now, sorry. Yeah, Susie, did you study any Romani community? Charmaine asked.
The main for my PhD work, it was Irish travellers that I worked with, because of the relationship I had with Irish community care. I had done a really small piece of work as part of a wider sexual health needs assessment with a Romani Gypsy, and she was fantastic. She was very open about sexual health, but she also explained a lot of the reasons why people might not be very open about sexual health. So I haven't got lots of experience, but I am aware that, you know, that there are some difficulties in talking about some subjects. We are hoping to recruit Romani Gypsies as part of the Swansea project. I think that people identify as different. So I think that maybe I might identify as Welsh Gypsies. So the answer is no, not really, just a little bit. But it's certainly not. I think that's sort of a gap in my work, really. But yes, Irish Travellers is the main focus of the PhD.
Thanks, Susie. Charmaine, did you want to add anything to that? Did you want to ask her, Susie, anything else?
No, just to add to it, I get, and I'm nodding along, and because the Welsh Gypsies, they're Kale, K-A-L-E, a very, very ancient tribe of Gypsies. Again, and along, it's like another tribe. And again, about sexual health and stuff, it's not really a thing that especially Romani women speak about openly with people, because it's very taboo, and it's not something that is spoken about, really.
I've got a question, I think, for the majority of our speakers. I mean, what we've noticed with COVID, that we've done a lot of remote working. So, for example, you've got things like healthcare appointments have become via telephone or via video consultation. Also with research as well, Susie, we probably relate to this, is that we no longer kind of do a one-to-one interview with people or focus group in the room. We tend to kind of try to do this online using, platforms such as Zoom that we're using today. I mean, from all our speakers, I mean, if you can kind of highlight what are some of the challenges do you think going forward if we were to continue? Because the likelihood of us doing some continuous remote working is likely to continue happening in the future. So what are some of the challenges that you think that the Roma and Gypsy traveller communities will find if we were then to continue in that kind of manner?
I think Alexandra's got a hand up, Shema.
Yeah. Can I speak? It's all right. Do you hear me?
Yes, we can hear you. That's
okay,
fine.
perfect. Yeah, I see this in the pandemic. I tell you, with the Roma communities, they don't know how to access the Zoom. If we'll do this in the future, they are in Facebook, or the majority. Like, you can also share the videos or what is about on Facebook. I think that will be very good also for the Roma to be able to access this kind of events, because it will be very helpful to see that the majority are interested of their communities and they want to help them and to engage with them. In general, only the Facebook, unfortunately, they don't use Zoom. We don't use also in our work WhatsApp, because is visible their phone numbers, and we don't want to have problems in the community, people to know their phone numbers and these kind of things.
I think Charmaine's got her hands up as well, actually.
Hi. I completely agree with Alexandria. A lot, especially the older community members in the Romani community, they would not have any idea how to work a Zoom meeting. And I mean, my mother's 74, and she'd just be like, what is this, the Zoom? Again, a lot of community members have problems with literacy and speaking and knowing like how to deal with like Zoom meetings and whatnot. The younger generation, they do use a lot of WhatsApp, but again, like Alexandria said, it kind of like mirrors the Roma community, also mirrors, because they are like our Eastern European cousins. So the communities and the cultural practices and stuff are very much similar to the British Romani child and the Eastern European Roma. So things that could be put on WhatsApp certainly wouldn't be shared with the whole community. It would just be a women's group and a men's group. But again, it's with literacy. A lot of Romani people have problems with literacy in reading and writing. So Zoom probably not, and they like to actually see faces in the Romani community and get to know those people. So it's again like the people were saying about the trust kind of thing. Who are these people and what do they want? They actually like to know who they're speaking to.
Can I ask whether you think if you were trying to build up relationships with people only via online methods, do you think that people, if you could get people on, you know, Facebook or WhatsApp or whatever, do you think that people will be able to connect via that way as much as they would by face to face, or not?
We've had to do a lot of you know, online stuff. I mean, I've had to do it with my sister, and again, the community is very much, especially the younger community. I'm going to say, so for people up to the age of 60, social media, they understand it, and they very much, you know, get how to work it. But then people over the 60 mark haven't got a clue of how to work it. And the community, everybody within our community has some kind of connection. So the Roman and Gypsy community, everybody's got some kind of connection anyway. Mm-hmm. So you can build up that kind of connection, but again, it's historically with trust, people from the outside. So they trust people that are inside of our community, but outside of our community, you have to build up that trust with them.
Thank you. Thanks, Charmaine. I just wondered whether, I'm going to go to you in a sec, Shema, but is Rayhana or Andrew here from Irish Community Care? Have you got anything to share about digital methods, or is Rayhana still here? Andrew?
Yes, I'm still here.
Oh, yeah. Do you want to go, Rayhana?
Yeah, I was just going to say Irish Community Care, we're currently running the digital inclusion programme, so it's actually working, but unfortunately that's just for city region population, and we're working with people to get them more used to using digital platforms and learning those new skills and learning how to access new technologies. But I think what everybody else is saying, it seems to be the same for us as well, is the face-to-face, building a relationship with the Travel to Independence, because it's a fairly new programme. And myself and Andy and Andrew last week when actually had to go on the sites to actually meet the families, rather than trying to do it through Zoom, because I think they need to have that face-to-face interaction first, and then once you've built that relationship, then if you wanted to then use technology, we could, but initially we would have to go, and we did, and we had a fantastic visit on the day. I mean, everybody was really great who we met. But I think first, as Charmaine said, if you're coming from the outside in, you need to go and build it face-to-face first, and then you can then use digital technology if you need to do so once you've built that trust. I don't know if, Andrew, you want to add anything to that?
No, that was perfect.
And Andrew, I think question. I mean, you mentioned things about people's access toward, healthcare services. Again, it's brilliant that everyone's mentioned how it can be difficult to kind of learn how to use Zoom, or even this confidentiality aspect of having, I don't want to share my number, I don't want to share my details. And you mentioned about building trust, but how can healthcare services actually build trust with the communities to enable them to kind of, still use the GP, still use the dentist, if it's like, use the GP, for example, if it's like a remote consultation?
I always found that if it was like a charity service, someone or quite a few people on sites or outside of sites, they'd always be quite open, especially obviously if they needed something. And from that point, it would just be word of mouth. There'd be confidence in that person or that service due to that. But yeah, it is important to have that face-to-face with that too.
I think Charmaine had her hand up again. She wants to contribute again.
Sorry, I have a lot to say all the time. Again, exactly what Andrew said. It is word of mouth completely. That's exactly how it works in the Roma community. So if, say, I had a good experience with you, I would then go and tell my sisters and my cousins and the other female, Roma people, and then they would go and tell their husbands, and it's like a, like a domino effect. So it's absolutely word of mouth, and if one person has a good experience, and then gauging things properly. If you've had a bad experience, it's word of mouth, and then that word is spread throughout the community.
Brilliant. Thank you, Charmaine. Anyone else would like to ask any questions or have a comment? Please do feel free to unmute yourself.
I was going to just add, I'm sorry, everyone, I'm going to have to go in a second to pick up my son. So I'm just going to say that Shema will be finishing off the forum, but we will be back in touch to talk about how we can carry on the conversations, and I just want to say thank you to everyone from myself for all your input. The other question I was just going to ask, if everyone else doesn't have one, was a lot of you are very Liverpool focused. Do you work with other people across the Northwest or just in the Liverpool region? And do you have ties with the other communities in further afield than Liverpool?
I think Alexandra had a hand up for that question.
Yeah, I work a lot of national work with Roma Support Group. We have a network of organization around UK, and we make a lot of advocacy and police worker because it's important for us to have a voice and representation when the government asks questions or when they have like a webinar. We are involved and directly we can say our views about the community. Here in Liverpool, for the Roma communities I work is only me and my organization, Grammy Talks to Development Trust, but I meet and I was very happy, Charmaine, to invite me in her community and to speak about my experience. And this kind of links is good between us because we are in the same umbrella, and it's good for us to support each other.
That's brilliant. Thank you so much, Alexandra.
Could I ask a question, please?
Yes, go ahead.
Yeah. And this is to everyone. I'd like to know, is there any literature, books out there that I can access that tells me the history, the culture of the Gypsy Roma travellers? Because I would really like to learn about the different communities. I'm quite fascinated, you know, all the different tribes, and I would like to share that with friends, families, yeah, and promote discussions about it and get people's feedback on that, yeah. And
I think Charmaine's can give you some feedback on that. She's got her hands up, which is great. Thank you, Charmaine.
Hi, yeah. There's a book called A Century of Romany Gypsies. That's
can you speak a bit slower? Sorry, Charmaine. What's it called?
A Century of Romany Gypsies.
A Century of Romany Gypsies, yeah.
And that's by an author called John McHale.
John McHale, yeah.
Yeah. And then there's another book, I'm not sure of the author, and that's called Bury Me Standing.
Bury Me Standing.
Yeah.
Yeah.
Then there's another book called When the Violins Stop Playing.
When the Violins Stop Playing.
Yeah. And then there's another one that's quite new, and it's called Stopping Places.
Stopping Places, yes.
And that's by Damon Labasse.
Stopping Places, Damon Labasse.
Yeah.
Okay.
Charmaine, could you just put the titles in the chat for us, and that might be useful for us to have as a resource? That'd be brilliant. Thank you.
Brilliant.
Thanks,
yeah,
Charmaine.
that'd be. And I'd just like to say to all of you that I'm quite shocked today to hear, you know, how you're treated, how you haven't been recognised, you know, by the government. I think basically, you know, and I was wondering, do you have MPs who represent you? Do you just have a voice to access to MPs and councillors? Do they help you? How does it work?
Does anyone want to answer to that?
I mean, I can say I don't know of any MPs that are working on it. I mean, politically, GRT are kind of a poison chalice to kind of help, I guess, due to planning issues, and, you know, it kind of goes up against the public. The only person I know of who's in a good position is someone called Mark Willis. He's a barrister, I think, and he does do a lot of work with people like FFT, and he helps to bring about I think he helped to get rid of the injunctions that were being done all over the country. But when it comes to political people, no, I don't know of any that actually help. No.
Okay. I'm just cautious of time, and I would like to give each of the speakers a final word. what would be the takeaway message that you would like our audience to take away from today's session? So if we can start off with Gosia.
I would say, I think one of the big barriers here, I would say people are afraid of asking questions. And if we want to change anything, we need to start talking, actually asking communities how the community wants to be called. It's really important. Again, working with the Roma, Czech and Slovak Roma community, I remember they were saying to me, we are not Roma, we are Gypsies, call us Gypsies. So I just think kind of respecting that and having a conversation, how do you want to be called? How, where do you want to meet? What would you like to do? Kind of working with the community and not kind of imposing things. I think that's really important. Starting with kind of open conversation, not having kind of, anything, how you want people to fit into your ideas. I think that's really important. So kind of just start with more of a clear mind and willingness to ask questions and hear sometimes hard stories. I think some of them mentioned today, but again, hopefully that's something to change, something you can learn from. Thanks.
Brilliant. Thank you, Gosia. Susie?
Yeah, I would echo what Gosia said. I think communication is a really important thing, and openness and transparency. And just be honest. And I think if you don't understand something, ask, and also listen. I think that's quite key as well. And just trying to be as flexible as possible.
Thank you, Susie. Charmaine?
Right, I've got a few, no shock there. Listen and engage with us, and ask people to share their knowledge and value their opinions. Take inventory of the skills and resources you have for our liberation. Be prepared to address the system of oppression. Learn what's important. It's not equal to direct, meaningful action, but learning is very important. And also, always ask questions, stay informed, be respectful, and ask permission of our community. But ask us questions. Let us sit at the table. When you have conversations, let us be part of those conversations, because knowledge is power.
Thank you. That's really powerful, Charmaine. Thank you so much. We've got Rihanna.
Well, Charmaine covered quite a few of it, but one of the things for us, and we want to ensure that we're going to do it to the Travel to Independence programme, is challenging the misconceptions and the stereotypes that are out there about traveller communities. And like everybody else has said, is to ask and also to listen. And if people out there do have knowledge and experiences, to make sure that we share them.
Brilliant, thank you. Susie, you've got your hand up.
Yeah, sorry, I just wanted to add, it's related to what Charmaine said on the information from Leedsgate about working with Gypsy and travel communities. One of the things it says at the top is that they always work to the principle of nothing about me without me. And I think that sums up their approach. I think that's quite a good principle, really. So I just wanted to add that alongside what Charmaine said.
That's brilliant, thank you. Alexandra?
All the speakers, they say the main points. I think for me, it's like, don't judge a book from the cover. It's like, ask the question and don't use the tolerance in your work. It's good you to know about the community that you work. Research, go on YouTube, put Roma history, go on Google, you'll find correct information. There are a lot of academics, they write about this, like research, and you'll find the correct answers. Don't stereotype, because this can be very harmful for the communities.
Yeah, thank you so much. And finally, Andrew?
Yeah, just communication, don't have any preconceptions. You always see when people go on site say it, they tend to be nervous. There's no need, just be open and to just have a chat, just normal things, really. Brilliant.
Thank you, Andrew. That's really brilliant. Thank you, everyone. It's been an amazing forum with great insight, especially the lived experiences that everyone has shared. I think it's so important that it's given us like a really deep in-depth to the actual experiences of the Roma traveller and Gypsy community. So thank you so much for joining us today. We've really enjoyed that. Just to remind everyone, we've got the session recorded. We will have that on our ARC Northwest Coast website. We will also be writing a blog following this, so do watch out for that. We will be having our next Seldom Heard forum in about 8 weeks time, so we'll keep you all posted. Thank you so much everyone for joining us. Thank you to all the speakers, it's been amazing. So thank you everyone, and I will let you go. We'll finish on time, 3 o'clock.
Yeah, can I just thank you as director of the ARC for all the hard work you've put into this, and we really do want to hear your voice. We really do want to know how we can help identify what the key questions are that we as researchers and the group in the ARC can help your community with, what your priorities are. You're here because we want to hear your voice.
That's brilliant. Thank you, Mark, for joining us. That's been amazing, and to hear your voice as well. Thank you. So thank you, everyone. I will let you go, and I will see you soon. Take care.
Thanks. Bye.
Bye, everyone.
Thank you. Bye.
Bye.